Chapter 16, Infection Prevention and Control, Protective Mechanisms in Asepsis. So, an infection is the introduction of an infectious agent or pathogen into the body that disrupts the integrity of the tissue. If the infection is not treated, then it will lead to illness and disease. So nurses share the responsibility of maintaining a safe and secure environment of care for themselves, the patient, and other members of the healthcare team. Nurses are also responsible for teaching their patients and their patients' families about how to maintain safety outside the patient care setting. Now, anything that would cause, that would be invasive or any invasive procedures or anything could potentially put the patient at risk for an infection. So in certain Foley catheters, in certain IVs, in certain cardiac catheterization, NG tubes, mechanical ventilation, central lines, PICC lines, any of those things would potentially put your patient at risk for infection. Also, lack of hand washing in between patients. That increases the risk. Improper perineal care increases your risk for urinary tract infections. So if you're not wiping front to back, you run the risk of bringing stool up towards the urethra, which contains E. coli. And E. coli is one of the top risk factors for UTIs, for patients developing UTIs. So making sure you're wiping your patient from front to back to try to prevent infections. So the infection cycle includes 6 components: the pathogen or the infectious agent, or the causative agent, you might see it written as the reservoir, the portal of exit, the mode of transmission, the portal of entry to the host, and the susceptible host. So characteristics of each one of these components can influence the pathogen's ability to produce an infectious disease and its ability to, spread from one source to another source as well. So nursing care focuses on breaking the chain of infection. So if we can break this chain, we can try to, prevent infection from occurring. Okay, bacteria, fungi, viruses, and protozoa are all microorganisms that can cause an infection. And the characteristics of the pathogen that influences whether the infection will occur or not, those include like the number of pathogens that are present, the virulence, or meaning the ability of the pathogen to cause a disease, their ability to enter the host successfully, and their ability to survive inside the host. Disinfection and sterilization are methods that's used to destroy pathogens. And so some of your healthcare facilities, when they're sterilizing equipment, they may use this mechanism. High temperatures can be effective in destroying viruses and microorganisms. So if your facility uses a steam sterilizer, you need high temperatures, at least 250 degrees Fahrenheit or 121 degrees Celsius for 20 to 30 minutes. Or if they're using dry sterilization, then you need at least 320 degrees Fahrenheit or 160 degrees Celsius for 90 minutes to 3 hours. So the next phase in the link is the reservoir or the source. That's where the place where the pathogen lives until a susceptible host becomes available. So, meaning until it's capable of being infected by the pathogen, the susceptible host. And so the reservoirs can be non-living or they can be living. So when we're talking about non-living, that would be like your cutting boards for food preparation, um, food, so like contaminated food and water can be non-living sources, or say countertops or beds or anything like that. If a patient that's contaminated touches the countertop or their side rail or whatever, and leaving, microorganisms, infected microorganisms there. Non-living hosts would be things, I'm sorry, that's non-living. Living hosts would be things such as plants, animals, humans, insects can carry pathogens as well. The most effective way to prevent the spread of microorganism is good hand hygiene. That's one of the most effective ways, having good hand hygiene and using sterile technique when it's appropriate. So if sterile technique is called for, then you should be using that. We should be using standard precautions on every individual we encounter. So standard precautions are a set of infection control practices that are used to prevent the transmission of disease that can be acquired by contact with blood and body fluids. So, meaning we use standard precautions on everyone. We treat everyone as if they're infected. So, anytime we're going to come in contact with blood or body fluids, we should be using the appropriate PPE, personal protective equipment, uh, with all individuals because we don't know who could potentially be infected. So, portal of exit. So for a pathogen to reach a susceptible host, it must have a means of exiting the reservoir, meaning the route by which the pathogen leaves the body. So pathogens can exit the reservoir um, through blood and body fluids. Well, body fluids and blood would be a part of that. Body fluids, genital secretions, urine, wound drainages, feces, emesis, sputum. All these are modes of for the pathogen to exit the reservoir or exit the body. The portal of exit and the mode of transmission work hand in hand. For the infectious cycle to continue, the pathogen has to be transmitted to a location where it can access a susceptible host. So the portal of exit transmission can be interrupted by um, identifying and treating patients who are infected with pathogens. So if we treat the person that's infected, then they can't transmit the pathogen to anyone else, right? Or using appropriate isolation precautions. So if your patient is on airborne precautions, making sure you use appropriate precautions there. If they're on, they could be on airborne, droplet, or contact precautions. So using appropriate PPE and isolation protocols, as well as in addition to your standard precautions to try to interrupt that chain. All right, so modes of transmission, they can be direct, indirect, or airborne. When we talk about direct transmission, that occurs when you have physical contact between the reservoir or the source and a susceptible host. So, in other words, you come in contact with an infected person. So, it could be their infected wound. It could be their blood or body fluids, a wound, some kind of way you come in direct contact with the infected person. Um, Indirect transmission can be two different things when we talk about indirect transmission. So indirect transmission, it could be fomite, which is an inanimate object such as the dressing itself, contaminated needles, contaminated surgical instruments, eating utensils, tissues, toys, things like that that are contaminated with the pathogen. Or indirect can also be via a vector. And a vector is something like a mosquito, a flea, a tick, or something like that that could transport an infectious agent. Or it could be airborne transmission. And so airborne transmission, that's like via droplets when you cough or sneeze or something. And so when you cough or sneeze, then the droplets that you emit into the air, if they're infectious, could potentially infect others. So again, our most effective way to break this cycle is proper hand hygiene, performing hand hygiene appropriately, disinfecting and sterilizing your medical equipment appropriately, using aseptic technique when necessary, using standard precautions so everybody is treated as if they're infected. So using standard precautions for everyone. And using respiratory etiquette, cover your mouth when you're sneezing or coughing. Dispose of the soiled tissues appropriately and wash your hands after the fact. These are all ways to effectively break that chain and prevent the transmission. Okay, portal of entry, that's how the pathogen enters the susceptible host. So the pathogen can enter a susceptible host through any body opening. So through your eyes, your ears, your mouth, your urinary meatus, your rectum, the vagina, any mucous membranes, the skin. If you have broken skin, the skin acts as a barrier to prevent bacteria from entering the body. But if there's broken skin or open wounds or something like that, that allows for bacteria to enter the body. So preventing entry of the microorganisms is, how we're going to prevent infection. Again, using sterile and clean items on patients, using your barrier precautions, so your proper PPE, such as gloves and masks, or using condoms as well can be a barrier precaution. Safely handling food and water, using good personal hygiene, avoiding high-risk behaviors, and using protection from insect bites and stings. So, your bug repellent and things like that if you're going to be outside where mosquitoes and ticks and things like that may be. So a susceptible host. So some characteristics of the targeted host also influence whether the pathogen can cause an actual infection or illness or anything. So the very young, the very old are more susceptible to infections because the very young have an immature immune system and the very old have a weakened immune system, putting them both at risk um, for infection because the immune system is not strong enough to fight off those infections. A person's nutritional status, so if they have poor nutrition, that can put them at increased risk for infection. Stress levels, if your stress levels are higher, that puts you more at risk. Your overall health status, if your overall health is not good, that increases your risk of infection as well. So how do we, decrease our susceptibility? Educating your patients to get their immunizations, teaching your patient about good health and good hygiene habits. Those are ways to decrease susceptibility. Teaching them about good nutrition, teaching them about using, bug repellent or bug spray, if they're going to be out. So that they don't, get bit by mosquitoes and things like that, helping them, identify ways to improve their living conditions are all ways we can try to decrease our susceptibility to infections. So like we said, our older adult populations are more at risk for infections for a variety of reasons. They have decreased immunity. They have, as you get older, you have tend to have more chronic illnesses. And we said chronic illnesses are something that, you know, decreases or weakens our body's immune system as well, further putting us further at risk. Poor nutrition. A lot of times our older adults have poor nutrition for a variety of reasons. Maybe they can't afford, proper nutrition. Maybe if they're frail, maybe they aren't able to um, cook or prepare meals appropriately. Maybe they have illnesses that prevent them from eating properly or things like that. Immobility, if they've had a stroke or have, different um, neurological diseases or things like that, causing immobility, that puts them at increased risk for infection. Poor hygiene, just physiologic changes overall that occur as you age, like your skin gets thinner. All those things increase the risk for our older adults being more at risk for developing an infection. So our body has some natural defense mechanisms to try to prevent infection. So our first line of defense is the skin. So like I said, the skin acts as a barrier to prevent bacteria from entering into the body. So if we have any break in the skin or wounds or anything like that, that automatically puts us at higher risk for infection because we don't have that barrier to prevent bacteria or microorganisms, pathogens from entering into the body. You have cilia in the respiratory tract. So the cilia in the respiratory tract help to trap microorganisms and debris and then propel them up and out of the body, with a wave-like motion. So when you have certain respiratory diseases like COPD, asthma, or things like that, and the cilia aren't functioning to their fullest, they aren't able to, propel those microorganisms and debris out of the respiratory tract like they should, therefore putting you at increased risk for infection. You have the Kupffer cells, which are in the liver, and they destroy bacteria that might have, found their way into the portal circulation, which is your liver, dealing with your liver. Gastric secretions. You have gastric secretions, which your gastric secretions are naturally acidic. And so that acidity helps to destroy pathogens that you may have ingested. And so when you do things to make that those gastric juices less acidic, like if you're abusing antacids or something like that or whatever, then that allows you to be at increased risk for infection. Okay, the body has a second line of defense. So say we do, microorganisms are able to enter the body. So then the body has a second line of defense. When microorganisms uh, or foreign agents or pathogen enter into the body, the body automatically raises its temperature in response to the infection. So then you get a fever, and the fever is designed to try to slow the growth of the pathogen until your other defenses can be mobilized. Leukocytosis is another second line of defense that the body has. And so that's when your white blood cells increase. So the white blood cells increase, and then they travel through the capillary walls um, into the tissue, where the pathogens are located, and they the engulf the invader, that the area that's invading the body with pathogens. Then you have phagocytosis. Phagocytosis is a part of the inflammatory response to try to destroy the bacteria and viruses. And then you have inflammation. And so inflammation is a localized protective response that's brought on by injury or destruction of the tissues. And so the idea with the inflammation is to keep the infection from spreading to the rest of the body. So the area becomes inflamed to try to localize that infection and keep it in that area and not spread to the rest of the body. Interferon stimulates antiviral proteins. And so the goal with the interferon is to prevent replication of viruses, prevent replication of the virus. So inflammatory response, we just said this is a localized protective response that comes about when there's injury or destruction of the tissue. So when inflammation occurs at the area, you may see redness, warmth, edema, pain, swelling at the site. The purpose, so the inflammation or inflammatory response has three purposes: neutralize and destroy the harmful agents, limit the spread to other tissues in the body, and prepare the damaged tissues for repair. So we have a third line of defense as well. A third line of defense, we got several different types of immunity in our third line of defense. So passive acquired immunity. Passive acquired immunity is immunity when you're given an antitoxin or anti-serum that contains the antibodies or antitoxins. So that would be like a tetanus injection or something like that would be considered a passive acquired immunity. A naturally acquired immunity would be immunity that the fetus receives when the fetus receives antibodies from the mother through the placental blood before birth, or it can occur as the mother is breastfeeding the infant. Now, this type of immunity is temporary, and it usually only lasts until the infant starts to develop their own immune system or whatnot. Then you have artificially acquired immunity. Artificially acquired immunity is like through your vaccines. So that's when you're given substances that contain the dead or inactive microorganisms or toxins. And so that's through your vaccine. So like your polio, your measles vaccines, your hepatitis B vaccines, influenza, things like that. So those are your immunizations. Then you have artificially acquired passive immunity. And artificially acquired passive immunity is when you're injected with antibodies that come from infected blood of people or animals. And so this one, it's usually given to people who've been exposed to hepatitis A or the mumps, and they have never been immunized before against these infections. And so it only protects them, just for a short while their body, develops antibodies or whatnot. All right, let's look at this question. Which person is at highest risk for developing a hospital-acquired nosocomial infection? A visitor, an employee, an 80-year-old cancer patient, a 6-year-old getting ready for discharge from the hospital. So a hospital-acquired or nosocomial infection is an infection that occurs while a person is receiving health care in a facility. It could be in a hospital, it could be in a long-term care setting, it could be in home health care services or whatnot. And so the answer is going to be 3, an 80-year-old cancer patient. So elderly patients, we say, are at higher risk for infection because they have a weakened immune system. They're more likely to have poor nutrition for various reasons, depending on, different comorbidities. They may be immobile and having chronic illnesses. And so it says this person has cancer. So the cancer alone is going to decrease your immunity or weaken your immunity. So on top of being 80 and having all those other decreased physiological factors, the person does have cancer. So they're going to be, out of these list of patients, the most vulnerable to developing a hospital-acquired or nosocomial infection. So surgical asepsis is actually sterile technique. And so, with the difference between surgical asepsis and medical asepsis, like we said, medical asepsis, you're reducing the number of microorganisms, whereas with surgical asepsis or sterile technique, you're eliminating and removing all microorganisms. And so, things that require sterile technique, obviously, if you're having any type surgery or invasive procedure or things like that. So with surgical asepsis, we're preparing and handling instruments and materials in a way that prevents the patient's exposure to living organisms. And so it involves sterilizing all surgical instruments used in surgery and the supplies that are used. So other things that procedures that nurses might do that require surgical asepsis or sterile techniques might be inserting a Foley or inserting an IV or inserting an NG tube or um, suctioning a trach or things like that. All those things require sterile uh, technique. And so okay, so hand hygiene, like we said, hand hygiene is one of the most effective ways to reduce the number of microorganisms on the hands. So, gloves need to be worn if you're going to come in contact with blood and body fluids. And you need to perform hand hygiene before and after caring for a patient. So, when we talk about hand hygiene, you want to make sure you take special care when you're uh, pay special attention to the nails, artificial nails, chipped nail polish, long nails. Those all serve as host sites for organisms associated with hospital-acquired infections. So that's why we say, keep your nails low cut, not wearing fingernail polish, not wearing acrylic nails, and things like that, because those are ideal for infections to develop. You want to wash your hands when you arrive to work. You want to wash your hands in between patient contacts. You want to wash your hands before and after performing an invasive procedure, after removing any soiled gloves, after handling contaminated equipment, after coming in contact with body secretions, before you eat, after you use the restroom, before you leave work. You want to perform good hand hygiene. Um, they do allow for using the antiseptic hand wash. When you're using that, you can make sure you rub your hands together until they dry. The drying effect is what is going to help cause the elimination or the removal of the microorganisms. So allow your hands to dry completely when you're using that. Using soap and water. When you're using soap and water, you want to use the antimicrobial soap and water. Rub your hands vigorously um, for a minimum of 15 seconds. And you want to use soap and water if your hands are visibly soiled or if you have taken care of a patient with C. diff. You don't want to use the antiseptic rubs like the Purell or things like that if your hands are visibly soiled or if you've taken care of a patient with C. diff. Okay, so standard precautions, like we said, where you're going to use standard precautions on all patients, meaning we treat everyone as if they are infected. And so all patients should receive standard precautions. So that includes hand hygiene, which we, just discussed. You're going to wash your hands, we just went through all the things, washing your hands, after patient contact, no matter if you wore gloves or not, before you go to another patient, you're going to wash your hands and all those things we discussed with hand washing. You're going to wear gloves. Anytime you have the potential to come in contact with blood, body fluid, secretions, excretions, or anything like that, you want to always wear gloves. Touching mucous membranes, non-intact skin, any of that, you want to wear gloves. Gown. Anytime you think your clothes may come in contact with blood or body fluids, you always want to wear a gown as well. These are your standard precautions. Mask, goggles, face shields. Anytime you think there might be splashing, say for instance you're suctioning a patient that is coughing a lot, and so you may wear a goggle or a face shield or mask or something like that to prevent splashing in your face. Soiled equipment. Making sure you handle it in a manner that prevents transfer of microorganisms to others, cleaning the equipment appropriately after each use, wearing gloves if the equipment is visibly soiled or anything like that. Your environment, making sure you're following the procedures of the facility as far as, keeping cleaning the environmental area, the patient area, the nurses area, disinfecting the surfaces like they're supposed to be. Your laundry, handling it in a way that prevents transfer of microorganisms. So you're not going to hold the laundry close to your body where, the infectious material can get on your clothes. If you have to transport laundry out of the room into the dirty laundry area, you want to carry it in a plastic bag. You're not going to just carry it down the hall in your hands or anything like that. Needles or other sharps, do not recap your needles. Most facilities will have, or some facilities will have the needles with the safety guard on them so that you don't have to worry about walking, with a needle that's open. But never recap. You don't want to recap. If you gotta say go from the med card to the patient and you don't want to walk with the needle open, then you can use the scoop technique. Just the scoop technique only. Don't bend the needles. Don't bend the needles. Don't recap the needles. You want to put them in a sharps container right away when you're done with them. PPE. If you need to wear your PPE, you want to make sure you put it on and take it off properly. When you put it on, you want your gown on, then your mask or respirator, your goggles and your face shield, and your gloves will be the last thing you put on. Now, when removing, the gloves will be the first thing you take off because your gloves will be soiled. So you don't want to touch any other area with soiled gloves. So the gloves will be the first thing you take off. Then you'll take off your goggles and your face shield, and the gown and the mask or the respirator will be the last thing you take off. Now, if you are wearing a respirator, you want to wait till you get outside the room to take that respirator off. And then after you remove all your personal protective equipment or PPE, you want to make sure you perform hand hygiene. Okay, so like I said, just like we do with our medications, anytime we're going to do a procedure, we still want to you're going to do your two identifiers as well, but you're going to ask for allergies, because we have some patients that are allergic to latex. And so we need to make sure we're not using, latex gloves, for those patients. Maybe, use a vinyl glove or something like that. So you want to find out, are they, do they have any allergies? Are they allergic to latex? People that have had a lot of surgical procedures, um, or people who are allergic to things like bananas, kiwis, avocados, or anything like that, may be at risk for developing a latex allergy. Some things that might occur if they are allergic: they might get redness at the site, local inflammation, pruritus of the hands, which is itching. Pruritus means itching. So pruritus of the hands, and anaphylaxis may occur in these individuals. So you want to make sure you use, some other type glove if you have to provide care of some sort. Now, if you, the nurse or the healthcare worker, has a latex allergy, then by law, your employer is required to supply you with the alternative glove. So, like we said, we're never going to recap needles. You never recap needles. You want to place them directly into a sharps container. So you should have a red puncture resistance sharps container that's marked biohazard, that you put your needles in immediately afterwards. All needles, all IV cannulas, any items that might cause a break in the skin, you want to put them into the sharps container immediately after use. You want to empty that, or not empty, but replace the sharps container when they're 2/3 full, because you don't want to run the risk of sticking yourself if you trying to put a needle in a sharps container that's full. Then you run the risk of sticking yourself with another one of those needles that's in there. And so you want to empty those sharps containers when they're about 2/3 full. Contaminated waste could be anything uh, that's soiled with blood and body fluids. So your soiled dressings, your used sanitary pads, your suction drainage containers, anything that's soiled with blood and body fluids would be considered contaminated waste. So you want to seal those in a bag that's marked hazardous or biohazard, and then your facility should have whatever your protocols are, where those biohazard bags are disposed of. It should be an impermeable plastic bag that's marked hazardous or biohazard. Don't hold contaminated linen next to you, or contaminated soil dressings or anything like that. Don't hold them close to your body. So, um, so your pathogens, if you clean or disinfect, sterilize, or sanitize, you can kill or inactivate, pathogens, so that they don't, cause anyone else to, be infected. So your book on page 236 outlines appropriate cleaning techniques. So it goes through the different steps 1 through 6 here. So rinse the object with cold water to remove organic material. Hot water coagulates the proteins um, contained in organic material, making them more adherent to the item being cleaned. And then number 2, once all visible organic material has been removed, wash the object in hot soapy water. Number 3, use a stiff bristled brush or abrasive to clean the equipment with grooves and narrow spaces. Friction helps dislodge soil. You want to make sure you're wearing gloves when you're cleaning these items. Number 4, rinse the object well with moderately hot water. Number 5, dry the object. It is now considered clean but not sterile. And number 6, always disinfect the cleaning equipment and the sink when you have finished cleaning soil objects. So that's the appropriate way to, to clean items. Um, Now you can disinfect agents. Disinfectant agents can be used to eliminate some type of organisms. Sterilization is going to be your best method for eliminating microorganisms. And so your facility, there's a variety of different ways that they can sterilize equipment. So it'll be, how your facility does it, but sterilization is going to be the best way to clean your equipment. Okay, an LPN is going in for her annual review. She is told to stop by Employee Health to get a hepatitis B shot. This is providing the employee with which type of immunity? Naturally acquired immunity, passive acquired immunity, naturally acquired passive immunity, artificially acquired immunity. And so the answer here is going to be number 4, artificially acquired immunity, because that's when you get the vaccine that contains the dead organisms. Brenda is a student nurse observing and assisting in the operating room. In order to maintain surgical asepsis, she must include all of the following except 1. Perform a 5-minute hand scrub before entering the operating room. 2. Use sterile protective garb such as gown, mask, and gloves. 3. Sterilize all instruments and inanimate objects used in the surgery. Or 4. Maintain clean technique while in the operating room. So the answer is going to be 4. Maintain clean technique while in the operating room, because this is medical asepsis, and if we're in the operating room, we need sterile technique. So we're not going to use medical asepsis in this situation. Right. Sherry is working as a home health nurse. She is teaching her patient and family about asepsis in the home environment. All of the following are true except 1. Precautions in the home environment are important. 2. Hand washing can be modified and is not as important as in the hospital. 3. Syringes are placed in a clean milk jug with bleach and water. 4. Frequent dusting and vacuuming are necessary to decrease the number of microorganisms. So the answer here is going to be number 2. Hand washing can be modified and is not as important as in the hospital. Hand washing is always important. Again, it's the most effective way to prevent the spread of infection and prevent the spread from microorganisms.